Picture someone having a stroke. What do they look like? Droopy face, slurring speech, wincing in pain? We all might have an idea about the warning signs, but did you know strokes can also strike in silence? In fact, strokes can happen without any pain at all. This is just one of the many misconceptions about strokes. And for something so critical, it's important to get your facts straight. Knowing the truth could save your life, or someone else's. So, let's strike down the many myths about strokes. Strokes are life-threatening emergencies because they cause damage to parts of the brain and have irreversible effects when not treated immediately, which is why it is important to be made aware of the common misconceptions of strokes, because when they happen, every second counts. We talked to Dr. Jennifer Justice F. Manzano, Program Director for the Asian Brain Institute at the Asian Hospital and Medical Center, Dr. Simbine Santiago, Chief Section of Neurology and the Chairman of the Department of Neurology at Makati Medical Center, Dr. Jessa Frank Castro, Stroke and Vascular Neurologist at the West Metro Medical Center, and Police Lieutenant Salvador Agudo, a previous stroke patient, to learn about their experiences and expertise.
Ang stroke, akala ko dati ay nangyayari lang sa mga matanda, mga edad na, hindi sa mga bata.
It is not true that strokes can only happen to older people. Although the incidence of stroke really rises with age, which means that age is a big factor in getting a stroke.
Stroke in the young is defined as people who suffer with stroke with the age less than 40 to 45. We look at what are the possibilities or the risk factors, and we have found out that there is also an increase in the number of hypertension among these cases. So aside from hypertension, there is also increased use of tobacco use, cigarette smoking, increase in sedentary lifestyle, so lesser people are doing their exercises. There's also a higher incidence of dyslipidemia, or an increase in the cholesterol in the blood, as well as diabetes mellitus.
The arteries get clogged with cholesterol deposits or lipid deposits in the walls of the arteries. The more you age, decades of eating, fatty food lifestyle that is bad, there is accumulation of these plaques or cholesterol plaques in the walls of the arteries. That's how sometimes a stroke occurs.
Nung araw na yun, ginanahan ako sa pagkain ng karne. Ayoko naman talaga, iniwasan ko yan ng karne. I prepare to eat, dapat vegetable lang lahat. Kaso lang, nung araw na yun, hindi ko maiwasan na punuin ko yung plato ko ng karne. Puro lang siya karne, isang scoop lang na kanin. Bigla akong naging matakaw. Kinabukasan nun, doon na yung naramdaman ko yung sintomas. Umiga ako, kaso lang, yung isipan ko gising. Naririnig ko yung kilis ng mga anak ko, yung asawa ko. Bumangon ako, tapos pumunta ako sa banyo. Habang binubuhos ko yung tubig, nararamdaman ko nagnanam yung kaliwang kamay. Nung humingi ako ng sabon sa misis ko, nararamdaman ko na sumayad na yung dila ko dito sa bibig ko. Doon ko napipil ko na parang na-stroke ako.
During stroke, when there is an ischemic stroke, a blood clot would travel to the blood vessel in the brain and will cause disruption. So hindi po nakakadaloy yung dugo dun po sa bahagi ng utak. Once the brain parenchyma or yung utak natin is deprived with oxygenation or the blood, yung cells po doon ay mamamatay. Once namatay po sila, irreversible na po yun. And that area with the brain, depende kung ano po yun, ang siyang maapektuhan. So pag motor area yung natatamaan, mawawala po yung ability to function. So kaya po nagkakaroon ng paralysis.
Strokes typically are not painful. Sometimes a stroke can manifest as a person is not able to identify a body part. There may be some personality changes. Now, there may be times when a patient actually thinks that he is blind, although the person is not really blind. The manifestations of a stroke, and I need everybody to remember this, be fast. Be fast is a mnemonic that is used worldwide to teach people about the symptoms and the signs of a stroke.
B, it stands for balance. We ask the patient or we ask someone we know to walk, try to walk. So they would complain of, para akong lasing or nahihilo ako. They tend to fall into either side. The second one would be an eye problem. So an eye problem, it could either be blindness or blurring in one eye or both eyes, or it could be due to diplopia, na yung sinasabi nilang biglang naduduling, no? Nagdodoble yung paningin. The next one would be face. We ask the patient to smile or we observe them while they are talking and we look at kung gaano kapantay yung mukha nila. So sometimes one side of the face or the lip is drooping, not moving, or one side of the eye, no, they are unable to close it properly compared to another, or they cannot raise their eyebrows.
You can have arm weakness. So, weakness of one side, or right arm and right leg, or the opposite side. You can also have numbness of one side. Speech problems. You can have slurring of speech, comprehension problems, or difficulty speaking, or even inability to speak.
These balance, eyes, face, arms, speech, any one of these is present, you should suspect a stroke. And what should you do? Doon tayo pupunta sa letter T. T stands for time. If you notice a person experiencing any one of these symptoms, that person should be brought to the nearest stroke-ready emergency room. So sa emergency room pupunta, hindi sa doctor's clinic, and dapat sa stroke-ready. Kasi pag hindi stroke-ready, the ER might not be able to help the person who is having a stroke.
So the golden hour for stroke is 4.5 hours, and this is the time where we can actually give a clot buster medication in order to lyse the clot in the brain. This would improve the outcome of those patients suffering from stroke.
When a person with a suspected stroke comes into the hospital, it really matters whether the hospital is stroke ready or not, because the response to the patient will differ. In a stroke ready hospital, pagdating pa lang ng patient sa triage area, naka-fast track yung patient, which means that the patient does not anymore go through the rigorous process of having himself registered in the hospital, the endless barrage of questions regarding history. Of course, we still do that if it is a stroke, but we fast track everything.
So it's important to go to an acute stroke-ready hospital like Makati Medical Center. All the services here are organized already. We have a brain attack team that we call a neuro response team, and everyone converges at the ER because time is of the essence. We usually do a CT scan of the brain or an MRI of the brain to confirm what type of stroke you have or if you've had a stroke. From there, we can give the clot buster or other maneuvers or medications in order to address that stroke. The outcome is better in the long run when it is addressed quickly.
1/3 of patients suffering from stroke really suffer with significant disability. So we have to explain to them and refer them for rehabilitation or physical therapy to help them recover from stroke. Aside from that, of course, we have to refer them to other specialists like the cardiologists to also help us manage their hypertension and other cardiac risk factors. Also, we can refer them to endocrinologists to help in managing the diabetes of this patient.
Simula nung paglabas ko sa ospital, may doktor ako sa heart, may sa neurologist, tsaka yung sa therapist. Yung tatlong doktor na yun, sinunod ko yung anong pinayo nila sa akin. Dapat daw yung therapy, regular yung therapy ko. Every week yun, pumupunta sa akin yung therapist, tapos tinuturuan nila ako kung paano gumalaw, pagkatakanta pa minsan, medyo okay. Sa tulong ng tatlong doktor, mabilis na gumaling.
We are also happy and proud to say that many hospitals within Metro Pacific Health are stroke ready. We are proud to share that Makati Medical Center and Asian Hospital and Medical Center even garnered the Diamond status from the Angels Award from the World Stroke Organization.
Magpapasalamat pala ako sa West Metro Hospital. Lumapit talaga ako sa tamang hospital kasi sa good accommodation nila, tsaka maganda yung pagtungo nila sa akin, plus yung pang tulong ng 3 magagaling na doktor, recover ako in 5 days, plus 1 month recovery.
Before, we did not used to expect people in their 30s to do this, but as we are seeing a rise in the percentage of stroke in the young because of unhealthy lifestyle, we urge you to go to your doctors, have your annual physical exam, do your blood tests to determine if you are at risk and address it properly as soon as possible.
We have seen a lot of stroke cases, right? And it is really a life-changing event, and it poses challenge on the patient not only physically but emotionally and mentally. So it is very important that us as doctors would be there to really explain to them what happened and guide them on the treatment and the management, and it wouldn't stop from there. It will also include guiding them on what they have to do after the stroke, like rehabilitation, identify patients who are actually really having a hard time because a portion of them would experience depression and mental health problems along the way. But the good news is that with the help of rehabilitation and a very good support system, it's very likely that a patient from stroke would improve eventually and they could get back on their feet again and perform their activities like in the past. So there is hope after stroke.
Presented by Metro Pacific Health, the largest group of private hospitals in the Philippines.